Everyone is talking about the 2026 Nclex changes right now. And if you're an international nursing student, this can feel even more confusing because now you're trying to understand a new exam system and a different healthcare approach and new expectations all at the same time. You're probably wondering, am I studying the right way? Is Nclex different from what I learned back home? But here's the problem. There is one major RN change that almost nobody is explaining clearly. And if you miss this, you could be getting questions wrong, even when you know the content. So let me break this down in a way that actually makes sense, especially for you as an international student. And this is something I see all the time. You understand the content, but the way Nclex asks questions is different because Nclex is testing how you think in a clinical setting. Your pattern might be slightly different. So here is the biggest RN change you need to know. Safety is no longer just general safety. It is now strongly tied to infection prevention and control. Nclex is shifting its focus. They are moving from what is safe to what prevents infection and reduces spread immediately. This is very important because infection control protocols may be stricter than what you're used to. In many systems it's important, but on Nclex it is a top priority decision-making factor. This includes hand hygiene before and after contact and the proper use of PPE. As well as isolation precautions and preventing cross-contamination, every step matters. You're thinking about what protects everyone involved, the patient, the nurse, and the environment. Let's test your thinking. A nurse is about to care for a patient with an infection. Which action should the nurse take first? A. Assess, B. Hand hygiene, C. Meds, or D. Document. Pause and think carefully. What would you choose? Correct answer, B. Perform hand hygiene. This is where many international students get confused. You might think assessment always comes first, but infection control comes before assessment. If you skip hand hygiene, you risk spreading infection immediately. That's how Nclex wants you to think. So write this down mentally. First action is not always assessment. Sometimes it's infection prevention. Let's go deeper. A nurse is leaving the room of a patient on isolation precautions. What is the priority action? A. Remove PPE correctly. B. Check another patient. C. Document. Or D. Call the provider. What's your answer? Correct answer, A. Remove PPE correctly because incorrect removal spreads infection. It contaminates surfaces and puts others at risk. The technique and order matters a lot on Nclex. As a nurse preparing for Nclex, your focus should always include hand hygiene and correct PPE use. Use this simple rule. If infection is involved, infection control becomes the priority. Ask, what stops the spread first? In real clinical settings, especially in the US, infection control is taken very seriously. You must adapt to this. Now be honest, would you have picked hand hygiene first or gone straight to assessment? Comment below. If you're an international nursing student, this series is for you. I'm breaking these changes down step by step. Pass your next exam using RN and LVN Refresher online help from Gab-Nic Excelsior Nursing Tutoring Center. Go to my profile, tap the link in my bio, and start learning the right way. Check the description for full lessons.
Profile. Once you're in, select the RN Refresher course. You'll also find a weekly timetable to help you study consistently and stay on track. So you don't feel overwhelmed while studying. Revisit important topics. It's not just about studying harder. So if you're ready to improve your understanding and stay consistent,